Hi everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about why patients refuse dental x-rays. And before we jump in, I'd like to remind you about my website, teethtalkgirl.com. If you're ever looking for a specific dental topic, I have a search bar where you can easily find what you're looking for, and also my Instagram, @teethtalkgirl. I need to start by saying and confirming, yes, you need updated dental x-rays on file at your dental office for them to properly see what's going on in between your teeth and below your gums. Without dental x-rays, it's like asking your mechanic to fix your car, but you won't let them open the hood to look at the engine. So let's talk about the 3 reasons why patients may decline or refuse dental x-rays and how to ease their concerns. Number 1, discomfort and/or gag reflex. Unfortunately, dental x-rays are not comfortable for most people. It's a big piece of plastic that we ask you to bite on, and I get it's a less than fun situation. Luckily, it is quick, and once it's over, it's over. But if you are someone who really has a hard time, whether it be due to pure discomfort, maybe you have tori, which are the bony projections on your palate or the floor of your mouth, or a serious gag reflex. I actually have a tips and tricks video to help patients stop gagging with dental x-rays, which I will link that video in the bottom bar below if you'd like to learn more. And you can also use the techniques from this video, how to take impressions, to help with preventing the gag reflex as well. Telling your dental provider ahead of time that you are a gagger or you have a severe gag reflex can really help them help you. Number 2, radiation. Lots of patients are concerned about radiation. The good news is the digital x-rays that we use today don't use nearly as much radiation as the traditional x-rays did decades ago. But even then, they were still safe. Today, it is actually possible to take a full mouth series of dental x-rays using less radiation than what you would be exposed to on an airplane flight from LA to New York City, or even from just eating food. In fact, a single tooth x-ray is equal to the radiation you would get by eating 2 bananas. So as a dental provider, I always have a radiation comparison chart on hand for patients who are skeptical. These charts clearly show and explain how digital x-rays use drastically low levels of radiation, making them even safer than the background radiation that we're exposed to on a day-to-day basis. I will also link my radiation comparison chart in the bottom bar below if you're interested. Number 3, finances. This one is tricky. I get it. When I didn't have dental insurance in college and they were like, oh, it's time for x-rays again, I was like, oh no, I'm not interested in something that didn't seem important to me at the time. I was on a budget. I was a college student. I just wanted my teeth cleaned. I get it. By the way, this was during my undergrad before dental hygiene school, so I didn't really realize how important x-rays were yet. Regardless, I think one of the best analogies is comparing dental x-rays to an oil change. If you get routine oil changes on your car, you are less likely to have an unexpected emergency, being you are getting ongoing checks and maintenance. Same with your teeth. And I get that some people want to gamble. Kind of like having insurance on anything, right? In the game of life. If nothing bad happens, you are good. But if something bad happens, then you are much worse than you started. And our job as dental professionals is to prevent that from happening. Because like I said, in the long run, dental x-rays will save you money because it'll save you from any big surprises. Just like the oil change, like I said. For example, say you take the x-rays and you come to find out that you have a small cavity to fill. Simple, affordable. But what if you wait too long and that small cavity that would have been a relatively inexpensive thing to fix turns into needing a root canal? Now we are getting much more expensive, much more time consuming. And truly, this is when most people tell me, ugh, it would have just been worth it to take the checkup x-rays instead of waiting and finding out this bad news too late. I'm genuinely trying to help open our minds to understanding each other. I'm not here to judge or tell you how to live your life or what your priorities should be. I'm just here to tell you how important your x-rays are for your overall health and wellness, and that they will truly save you money in the long run. And before we go, if you want to learn more about x-ray safety, types of x-rays, or how to understand your x-rays, I'll link all of my x-ray videos in the bottom bar below. I hope this video helped you. Please like and subscribe if it did. If you want more teeth talk, you can visit my website, teethtalkgirl.com, for more dental articles and dental videos. Peace, love, and teeth.